Okay, first let's talk about seborrheic dermatitis. With this condition, you're going to have greasy looking scales that are usually affect the scalp and your face. To treat this, you can use topical antifungals like ketoconazole. You can also use salicylic acid, coal tar, topical steroids, and topical calcineurin inhibitors like tacrolimus. It's important to remember that this condition is associated with Parkinson's and HIV. Also, this condition is chronic and relapsing, so you might need to intermittently retreat the patients. Next, we'll talk about seborrheic keratosis. This is when you'll have that classic stuck-on appearance, and this condition is associated with lesser Trellat sign, which just means that you're going to have an acute onset of a lot of these showing up at the same time. And when that happens, that indicates internal malignancies, usually of the GI tract or the lung. And this is a clinical diagnosis and no treatment is needed. Next, we have Pemphigus Vulgaris. This will be flaccid bullae, and it's important to remember that it will affect the oral mucosa as well. You'll have anti-desmosomes antibodies and antibodies against desmoglein 1 and 3. When you do a biopsy on immunofluorescence, you're going to see net-like IgG and C3 deposits. You'll also have a positive Nikolsky sign with this condition, which just means your skin sloughs off pretty easily. This is also seen with Stevens-Johnson syndrome / TEN and also Staph-Scalded syndrome. And to treat Pemphigus vulgaris, you do systemic steroids. Next, we have Bullous Pemphigoid. With this condition, you're going to have tense bullae, and you're going to have anti-hemidesmosome antibodies, which is against the basement membrane. To diagnose this, you're going to do a skin biopsy, and to treat it, you're going to give topical steroids. Dermatitis Herpetiformis. This is associated with celiac disease. There's 3 antibodies you should know for celiacs, which are anti-transglutaminase, anti-gliadin, and anti-endomysial. You're going to have these like crusting vesicle, itchy lesions, most commonly seen on buttocks, but also on the extensor surface of your elbows, knees, or back. Here we have some skin tags, and this is associated with insulin resistance, obesity, pregnancy, and Crohn's disease. Vitiligo is an autoimmune condition where your skin loses melanocytes, so it's no longer able to make pigment in certain areas. And it's important to remember that when you have one autoimmune disease, you have more risk for other autoimmune diseases. So for example, a patient with vitiligo might also have pernicious anemia, type 1 diabetes, thyroid conditions, alopecia areata, primary adrenal insufficiencies. These are just a few examples. And to treat vitiligo, you can do topical steroids. Lastly, we have keloids. This is a benign condition. It's an overproduction of extracellular matrix and of dermal fibroblasts, and to treat this you can do intralesional steroids.